You know, Alzheimer's is one of the biggest health challenges we're facing today. But what if the key to fighting it wasn't some new drug, but actually a lost rhythm inside the brain? We're going to dive into a really fascinating new approach that could totally change how we think about treating this disease.
Okay, I want to start with just one number, 12 million. Just let that sink in for a second. The sheer scale of it.
Yeah, 12 million. That's how many people right now in Western societies are living with Alzheimer's. And, this isn't just some statistic on a page. It's a silent epidemic. It's really become the defining health challenge of our generation, and it's touching millions upon millions of families.
So to really get a grip on this challenge, we have to look deeper. We have to go beyond the surface. Because Alzheimer's, it's so much more than just, being a bit forgetful. The real question is, what's actually happening inside the brain?
So you might be thinking, is Alzheimer's just about losing your memories? And that's the question pretty much everyone asks. But the simple answer? No. It's way more complex than that. And here's the kicker. It all starts long, long before we even notice the most obvious signs. See, the whole process is incredibly sneaky. It often kicks off silently, deep inside the brain's memory hub, a place called the hippocampus. And get this, it can start more than a decade before symptoms like memory loss even show up. That's a huge deal. The damage is happening way before anyone gets a diagnosis, and that's exactly why it's so tough to catch it early.
Okay, so here's where it gets really interesting. How does our brain even save memories in the first place? Well, it relies on something called theta oscillations. The easiest way to think about them, they're like the brain's natural pacemaker for memory. These rhythms are absolutely crucial, especially when we're sleeping. That's when they're hard at work, encoding our experiences and filing them away.
And right there, that's the core of the problem in early Alzheimer's. The disease makes these vital rhythms just fade away. And when that happens, the brain's entire system for saving new stuff gets disrupted. So it's not really about struggling to remember things from the past, it's about the brain losing its ability to save new memories. It's like the save button is broken.
So that begs the question, right? If the problem is a lost rhythm, what if we could bring it back? This is where we get to a really innovative new idea. It's an approach that's shifting the whole conversation away from just, managing the decline to actually trying to restore brain function. And this is it. It's called the VGuard device. It's a non-invasive therapy that's designed to be used during that supercritical window for memory, when we're asleep. And it's not a drug. It's a piece of wearable tech that's all about trying to reactivate the brain's own natural systems.
So how does this thing actually work? Well, it's pretty straightforward, really. Just 3 steps. 1, you wear it at night, so the therapy happens right when your brain is naturally trying to consolidate memories. 2, it sends this gentle stimulation to something called the vagus nerve, which is like a major highway of communication to the brain. And 3, that stimulation is designed to fire up those theta rhythms again in the hippocampus, basically helping the brain get its memory-saving groove back.
Okay, so this all sounds great in theory, but what does the actual science say? Let's take a look at some early but honestly fascinating results from a pilot study that was set up to test this exact idea.
Now, before we jump into the numbers, it's really important to get the context here. These results are from what's called a randomized, double-blind, sham-controlled pilot study. Now, that's a mouthful, but in science, it's the gold standard. It basically means nobody, not the patients, not the researchers, knew who was getting the real deal and who was getting a placebo, or a sham treatment. And the findings are what we call hypothesis generating, which is a sciencey way of saying they're a really powerful launching pad for bigger studies down the road.
All right, so this chart gets to the heart of it. It uses something called the ADS cog scale, which is a standard way to measure cognition in Alzheimer's research. Now, here's the most important thing you need to know. On this scale, a lower score is better. A lower score means better brain function. So if you look at that blue line for the active group, you can see their scores went down. That signals an improvement. But the red line, the sham group, no real change. This is huge because it suggests the therapy might actually be linked to improving cognition, not just hitting the brakes on decline.
This point is so important. It's worth hearing it straight from the study manuscript. They wrote, and I quote, "The primary outcome of the study was the significant improvement in patients' cognitive abilities, rather than merely halting or delaying the progression of the disease." Wow. I mean, that's a total shift in the goal of therapy, isn't it? It's moving from just playing defense to actually going on offense, trying to restore what was lost.
So what could all this mean for the future? Well, this isn't just about one new piece of tech. It's pointing towards a completely new way of thinking about care for neurodegenerative diseases.
This table really lays it all out. You've got things like antibody treatments, which need IV infusions in a hospital, plus MRIs. Then you have other stimulation techniques that you have to go to a clinic for. But VGuard, it's designed for long-term, medically supervised use at home. That makes it so much more scalable and easy to integrate into someone's life. It's about moving this really complex care out of the hospital and right into the patient's own home.
So let's just quickly recap this new model. This is a real medical therapy prescribed by a doctor, not some wellness gadget you buy online. It's used at home, either by the patient or a caregiver, but, and this is key, it's all monitored remotely by specialists. The whole idea is for it to just blend into daily life, making long-term care way more manageable and, frankly, more accessible.
And that really brings us to the big final thought here. When you see innovations like this, you have to wonder, could the future of treating these devastating diseases be less about endless trips to the hospital and more about restoring the brain's own natural rhythms, right in our own homes? It's a really powerful vision for what the future of brain health could look like.